Hi, I'm Dove Sinclair with the Power of the Patient Project. My guest today is Adam Cherrington. Adam is the Research and Patient Engagement Director at KLAS Research. Adam earned his MBA at the University of Utah and his bachelor's degree in marketing communications from Brigham Young University. Prior to joining KLAS Research, he spent over 7 years at Apex EDI, and prior to that, 4 years as a client partner at Franklin Covey. Today, we are going to talk about patient engagement and the effects on the patient-provider relationship. So welcome, Adam. Thank you so much for joining me.
Thanks, Doug. Glad to be here.
So first, can you just start by telling us what KLAS does and explain your role as the Director of Patient Engagement?
Yeah, happy to do that. And again, thanks for the invitation. I love what you all are doing, and really excited to share some things. So, KLAS is an independent research firm, and we talk to providers and get their perspective on technologies. You could think of us like a JD Power and Associates or like a Consumer Reports. And so we truly get to find out straight from providers their experience on technologies and what they're accomplishing. We will conduct about 20,000 phone interviews a year, and we get to, like I said, hear directly from them. And I may be talking with you right now, and then with the CIO of a health system next, or with the healthcare vendor next. But we, unlike Consumer Reports, we don't share our opinion. We share the opinions of healthcare professionals, and so it's really fun. We're really on the front lines of hearing what's going on in healthcare and what's important to providers. So my role as research director over patient engagement means I'm trying to understand what that term even means. First of all, it's such a broad term, and it means so many different things to so many different people. But it's something that I think is really important to healthcare. If you can see this quote here, Dove, this is one of my favorite quotes from Adrian Boise, Chief Experience Officer at the Cleveland Clinic. It's an oxymoron to call it patient engagement and not involve the patient. And so when you and I connected and I heard about what you're doing, I really got excited because this is so important. The voice of the patient is absolutely critical. Historically, patient engagement just meant the patient portal, and we have to get a certain percentage of patients using a portal, and that was about it. But it really needs to mean so much more than that. One more example as part of my introduction here. I had this call just a couple weeks ago. A CIO of a major health system said this on a call to me. I love working in healthcare, but I hate being a patient. I feel so stupid. And he happened to explain an example where he couldn't even explain a bill from his own health system to his wife. And so, boy, I think a lot of us have been there before. I think we felt that the frustration of just being a patient and how challenging it is. So that's a long-winded introduction, but I'll just say I'm really excited about what we're learning from the patient's perspective. And I've got some things to share with you that the patient's needs don't always line up with the provider's needs or the vendor's focus. And so we really have an opportunity to amplify the patient's perspective.
Yeah, no, definitely. And speaking on the patient perspective, I know that you guys did a study where you interviewed around 300 patients on their perspective of patient engagement technology. Can you explain some of your findings and whether or not there were any significant variations between the patients and providers?
Yeah, happy to share that. So that's something that came out pretty quickly in that research, and this we really didn't know what we would find. We interview a lot of providers, as I've mentioned. We have their perspective on where they're focused, but we went out and asked patients, hey, what's important to you? What technologies are making a difference? So what you're looking at is just a chart from that study. The orange dots represent what's important to patients, okay? And so it's organized by patient desirability. The black dots here represent where providers have told us they are focused. And the blue dots are some of the areas of emphasis of vendors, what they're developing or have developed or what's on their roadmap. So you can see that there's quite a bit of variation here. In these top 4 areas, if I can just highlight what patients are telling us, top priorities are things that help arrange care, like self-scheduling or self-registration, patient check-in, like remote check-in, prescription refill requests, insurance verification. If you think of, if we put our patient hat on, don't we want more simplicity? You know, consumerism is alive and well. I can think of anything I need on Amazon. It'll probably be here tomorrow, if not today, in many cases. We can order food from anywhere. Travel is easier. But healthcare just feels archaic in so many ways. If there's a silver lining from a pandemic, as morbid as that sounds to even say that, some of these things have improved, right? We can connect in better and more efficient ways because of COVID. Things like patient intake and self-scheduling, virtual check-ins. That's happening more now, so that's a good thing. Next, patient empowerment. What we mean by that is giving patients access to their own data. You can see that this is a high energy area for patients, but kind of just moderate energy that we learned from providers and vendors. Next, patient account management. This is price transparency. We want to know what are things going to cost in healthcare. That seems like such a basic transactional question that should be easily answered, but it is complex. I think we can all appreciate, those of us that work in healthcare, we understand the complexity, but on the patient side, that should be the first thing we understand. But it's also related to things like online bill pay and explanation of our bills. So you can see there's really wide variance there on where vendors have been focused and provider offerings. But as patients, that's at the top of our list. Finally, finding a provider. We want online searchable tools to find providers that can help us and specific to our needs. This also includes things like triage symptom checkers. Patients are becoming more and more wise about their healthcare and more involved. And so luckily there's some alignment on some of these things down below, like coordination and education. But boy, there's a lot of different things out there that patients really want us to focus on.
Right. Yeah. I mean, just looking at this chart, like like you said, there's so much variation. I think it's so important that we start to notice these differences, that the healthcare system can become more copacetic overall.
Absolutely.
Yeah. And now, based on your research, were there any certain technologies that patients were finding most helpful, or anything that they would like to see more in the future?
Yes. So patients were talking about the concept of consolidated patient portals. They didn't always use that exact term, but they were describing things like, I just wish there was a one-stop shop. I wish I could find what I need in a simple, accessible tool. So that was absolutely something that came up frequently. Now, interestingly, telehealth came up as something they'd want to see more of in the future. And then we had a pandemic come, and all of us, most of us, have had an experience with telehealth. So I would expect to see that amplified a little more when we do this study again. We're about to go interview 5,000 to 10,000 patients and just ask them, what else is going to be helpful? What else do you need? And what else is out there? But things like just better communication, better scheduling, things that make a lot of sense for us as patients.
Yeah, definitely. That's going to be great with that new project that you're going to take on.
Yeah, we're excited.
Yeah, that sounds really exciting. And in your opinion, what are some things that patients and providers can be doing differently to cultivate a better relationship?
Here's some of the key findings and what I would point to. It's really a three-legged stool that has to be present. All three legs need to be there. Um, Vendors have to focus on their key stakeholders in the providers. That's who's purchasing this technology. So that will continue and needs to continue. But we're also encouraging vendors to make sure that patient voice is better represented.
Right.
As we just showed on that previous chart, they don't always align. There are differences there.
Mhm.
So as we truly try to make things patient centric, I believe that that's going to meet the provider's needs. You think about what's important to them. They want patient retention. They want better outcomes. They want improved reputation management so the patients will be retained and they can acquire new patients. Well, all of those things can come to fruition if a patient is seeing better results for themselves, if they have easier access, if communication is improved. So by focusing on the patient and including them, providers should be able to achieve their outcomes and their goals in an easier way.
Right.
So increased communication and including the patient more and more should really be at the forefront here. I bet you could go to any vendor website and see the terms patient centric on a lot of things, but what is that truly happening? I would say in most cases it's not, but we do hear examples where groups are inviting patient advocacy boards and really trying to step up and involve them more and more, which is really great and refreshing. We mentioned the concept of a one-stop shop.
Yep.
That is alive and well. That's a desire we have. In the age of consumerism, we want things to be easier. We want it at our fingertips. We want to be involved in our decisions. It's not, you don't have examples so much where we're willing to just accept whatever doctors just tell us, meaning we don't just go to them and say, I'm going to do everything they say every time just because they have a medical degree.
Mm-hmm.
We are more interested in learning ourselves, and we have access to more information now than ever before. So I think better communication, recognizing that there is a difference of patient and provider and vendor priorities, and then trying to align those priorities. That's truly what we need to see.
Mm-hmm. So it really all comes down to the patient and the patient's needs then. That's great. Wow. Is there anything else you would like to add?
Yes, just this idea that there are some, to summarize things that we've already said, I believe any organization that follows these type of principles and these fundamental pieces of patient engagement technology can really see some positive growth and increases.
Mm-hmm.
We talked about patient centric. The care and the technology really needs to be personalized. It really needs to know me as a patient.
Mm-hmm.
Keep me connected and make it very, very simple. And when these technologies are timely, I'm getting data that matters to me and my family, and it's ongoing access to my care and my medical information. That's when I want to engage as a patient. If the portal had all the things that I need in a simple way, I believe we would use it more. Most patients only log in periodically, and so as we follow these type of principles and fundamentals, I really expect to see some improvement there.
Yeah, no, definitely. I completely agree. Well, thank you so much for these slides and all that you do at KLAS and presenting us with this great information, the research that you've done. I think it'll be really beneficial to patients and providers. So thank you for explaining all this.
You're very welcome, Dove. I love what you all are doing. Happy to share our data anytime. if any of your participants have questions, we're more than happy to help. Our mission is to improve healthcare. So if we can do that for you or your team or any of your participants, we're happy to help.
Perfect. Thank you so much.
Thanks.